I wanted to talk about a medication adverse event that happened rather recently. So it involves a medication called Baclofen. Baclofen is a structural analog of GABA. GABA is an inhibitory neurotransmitter. It stands for gamma-aminobutyric acid. There are two receptor subtypes two receptor classes for GABA. There's GABA A, which is something that benzodiazepines work on, like Xanax and Valium, and then there's GABA B. We don't really fully understand the mechanism of Baclofen, but we think that it acts on GABA B receptors. So this is an interesting medication. It's used mainly for muscle spasms. In excess or in toxic doses, it can be very bad. It can initially cause confusion, delirium, and it can progress onto encephalopathy, hallucinations, flaccid paralysis, respiratory depression, and at worst coma. So I have a patient who is on dialysis who is CKD5, chronic kidney disease, like level 5, that I watch out for. I watch out for all my CKD patients. I watch all their medications that come in and make sure it's appropriate. Her primary care provider sent in a Baclofen 10 milligram tablet daily. For most normal patients with normal functioning kidneys, it's dosed multiple times a day, sometimes 3 times a day. But I saw this and I went to literature, and a lot of literature was saying you should avoid that medication in these patients. And if you want to use it in those patients, maybe do 2.5 milligrams or maybe even 5 milligrams every other day. So I went ahead and put a note, a forced counsel to talk to the patient. Before they went to pick it up, I said you should probably avoid this medication. The dosing should be maybe half that, way smaller than that, dosed every other day. I put all this into this counsel for this patient, and then I moved on and verified some of their medications. So a few weeks later, patient came in and I talked to her and I was like, hey, yeah, I remember you. I put in a counsel for you to talk to us about you. How did it go with the Baclofen? And she said that it put her in the hospital. And I looked back at it, and another pharmacist overrode my note because the technician changed the manufacturer, the NDC of the medication. It went back to data entry review, and the other pharmacist, because it didn't have like an entire hard block on it, it was more of a warning of monitoring this patient. This might not be appropriate. It wasn't like a blatant warning. So it was overridden, and my note did not go to the patient. So the patient was hospitalized for 5 days. And I asked her how she knew that she had Baclofen toxicity. I asked if she had hallucinations, and she did. She said she was searching for things in her car all night, and it kind of made me think I should have talked to the provider about this instead of forcing a counsel. So that is something that happened recently that I've been thinking about.